From the JAMA Network, this is JAMA Clinical Reviews, interviews and ideas about innovations in medicine, science, and clinical practice.
Hello, and welcome to this JAMA Clinical Reviews podcast. I'm your host, Dr. Karen Lasser, Professor of Medicine at Boston University and Senior Editor at JAMA. Today, I am joined by Dr. Lisa Iezzoni, who is a Professor of Medicine at Harvard Medical School and is based at the Health Policy Research Center at Massachusetts General Hospital. Welcome, Dr. Iezzoni, to this JAMA podcast.
Thank you. Happy to be here.
To begin with, could you orient our listeners to the differences between emotional support animals, therapy animals, and service animals?
Let me start first with a more general term, which is an assistance animal. There's new categories of assistance animals that have proliferated today. We're going to be talking today about service animals, and I'll define those later. But let's start with defining an animal such as an emotional support animal, which can be any type of domesticated animal which provides companionship to a person with a disability. The animal can also be viewed as a pet. The main point is that this animal is not specifically trained to perform particular tasks for their owner. Therapy animals, in contrast, are used by professionals such as counselors, and they typically provide comfort to multiple persons. And so it's not like an emotional support animal, which is very individual. Therapy animal can be brought into a group to assist multiple people. So let's talk about service animals. So we are going to be using during this podcast the definition of service animals that is part of the Americans with Disabilities Act, which was passed in 1990 and which I'll just call the ADA. And we're going to be using a definition of service animal that applies to Title II and Title III facilities under the ADA. Title II facilities are facilities that receive public funding, such as state or local funding, whereas Title III facilities are private facilities that are open to the public and provide services to the public. So, under the ADA definitions, a service animal is specifically any breed of dog that is trained specifically to perform work or tasks for a person with a disability. And the work or task for which that dog is trained must relate specifically to its handlers, and that's the terminology that's used, the dog's handlers' disability. And the service animals do not require specific credentialing, like through various programs of training. They can be actually trained by their handler, but again, they are specific for assisting their handler with particular tasks relating to their disability.
And other than dogs, are there other animals that can work as service animals?
Well, the ADA, as I've just said, Dr. Lasser, relates specifically to dogs, but they did recognize that there are people from certain cultures or parts of the world or religions who are uncomfortable with having dogs in private spaces. And so therefore they do make provisions that miniature horses can serve as service animals so long as they fit the same criteria that I just defined for a dog, that they're trained to help their handler who's a disabled person, and that they're trained to provide tasks directly related to that handler's disability. Let me say that miniature horses are out there, but they're exceedingly rare. But they are this option for people who do not feel comfortable with dogs.
Excellent, thank you. Now, could you tell us a little bit about the history of service animals?
So, service animals have been around for literally millennia. You can actually see pictures of medieval art of service animals kind of leading their owner. They formally became recognized in the post-World War I period when the German Shepherd Dog Society in Germany started training German Shepherd dogs to support veterans who were blinded specifically during World War I. And there was an American philanthropist who was also a dog breeder named Dorothy Harrison Eustace, who went over to Germany, saw what was happening with the German Shepherd Dog Society, wrote about it publicly, and people who were blind in America said, we want that too for ourselves. And so Dorothy Harrison Eustace was the person who founded the Seeing Eye, which is a registered trademark. It's the first U.S. program for training guide dogs. And the dog has kind of a very specific appearance. They have a rigid U-shaped harness, and they basically became kind of the quintessential service animal in America starting in the early 1930s.
Excellent. My next question is, which people with disabilities can service animals assist?
The ADA definition allows the handler to train their service animal specifically to perform disability-related tasks for that person. And so it's going to be very specific to the individual with a disability and their needs that they have. But common types of service dogs, obviously, include service animals for guiding blind persons, for alerting deaf people. There are service animals who pull wheelchairs, who stabilize people with balance problems. Service animals can also be trained to pick up or carry objects for people who it might be hard for them to pick up things from the floor, for example. There are service animals who are trained to help people with psychiatric disability to take a medication or to alert a person who's having a seizure that there's a seizure maybe about to happen. There are service animals who help people with autism identify sensory or social signals. There are also service animals who've been trained to alert people with diabetes that they might be having an abnormal glucose level. And those are animals that have been trained previously with sweat from their handler during prior hyperglycemic or hypoglycemic episodes. And then also kind of well recognized most recently are service animals who help people with post-traumatic stress disorder or PTSD during anxiety attacks.
That is impressive. What are some of the challenges of having a service animal?
Well, first of all, the handler and the service animal need to get to know each other. And they need to fit with each other temperamentally in terms of the service animal's ability to suit the needs of the person with a disability. And so sometimes with some of the professional training programs, it actually takes quite a while for the training to occur. But then after somebody is trained and matched with their service animal, and maybe the handler again trains that service animal themselves, there are some more logistical problems that might be an issue. For example, service animals need to be integrated into the person's life. The person is going to need to be able to afford food for the service animal, to afford veterinary care for the service animal. Service animals do get sick, and this can cause kind of emotional concerns for their handler. And it also may be a difficulty for the handler if they are very dependent on that service animal when the animal can no longer work. And then people with disabilities on average have higher rates of disadvantages on social determinants of health. And you can easily imagine how some of those concerns that affect people are also going to affect their service animal, such as poverty, housing and food insecurity, dangerous neighborhoods, problems with transportation, and other problems can affect, again, both their handler and their service animal.
Now, what should clinicians know about ADA rules for patients, visitors, and other members of the public bringing service animals into healthcare settings?
That is a terrific question because, as I just described to you, service animals provide many services for people for whom the disability is not apparent. For example, a service animal who assists somebody with a seizure disorder or somebody who has diabetes. And so it may not be always obvious, why the person is bringing in the service animal. The ADA does permit organizational staff to ask questions about whether an animal accompanying a person is a legitimate service animal and therefore under the Title II and Title III laws is required to be allowed in the facility. And so there are two questions that you can ask. And the first is whether the animal is in fact a service animal that is required because of disability. And the second question that you can ask is what are the work or specific tasks that that animal has been trained to perform. It is not legal to ask for medical documentation, to ask for information about the handler's disability, to require that the person provide a license or training documentation or identification for the dog. It's also not necessary for the dog to necessarily wear an identifying vest. You've seen those service animal vests. It's not necessary that that animal wear a vest. And it's also not permitted for you to ask for a demonstration that the animal can actually perform the stated task.
And under what circumstances may staff eject service animals?
Okay, another great question. The handler must have the animal in control. So if the animal is misbehaving and not under the control of the handler, and that control can be by different means. It can be by leash or by harness or by tether, by voice commands or by hand signals. Staff are allowed to, in that circumstance, ask the person to take the service animal out of the facility. If the animal is not housebroken, that is also a permitted reason to remove the service animal from the premises. As in other aspects of the Americans with Disabilities Act, if the service animal is taken away or not allowed in the facility and the provider must offer the opportunity for that patient to obtain the same services but without the animal present in that instance.
Okay, that's very helpful. Are there any circumstances under which primary care clinicians should be writing letters for patients authorizing service animals?
So service animals, again, can be trained by the handler, and they're not considered something that's medical. And so prescriptions are not, in fact, required or asked for service animals, with maybe some exceptions. There may be some specific training programs for service animals that do ask for a prescription from a doctor, but that is not typically required. In contrast, there may be instances when other type of support animals, like the emotional assistance animal that I talked about earlier, may sometimes require a prescription from a doctor.
Okay, thank you. Now, is there anything else our listeners should know about service animals that we haven't talked about?
I think that it's important for you to make sure that your facility has policies relating to service animals being present and that you are aware of what those policies are. Because I think that a lot of physicians really do not know what the policy is. They may make assumptions, for example, about the need for a prescription or the need for an animal to wear a vest, or may ask kind of intrusive questions. People can get into trouble by asking questions that are not permitted under the Americans with Disabilities Act. And so I think it's just really important for facilities to have policies well established and for the healthcare professionals at that facility to be trained in those policies.
Excellent. That's very helpful. I'm Dr. Karen Lasser. I've been speaking today with Dr. Lisa Iezzoni from Harvard Medical School about service animals. You can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.